If you've been taking Tirzepatide and not seeing the results you expected, you're not alone. Let's talk about why this happens and what you can do about it. Tirzepatide is a dual GIP and GLP-1 receptor agonist that's FDA approved for type 2 diabetes and for chronic weight management in eligible adults. It's not approved for type 1 diabetes. This medication works by enhancing insulin secretion when your blood sugar is elevated, suppressing glucagon, and acting on appetite centers in your brain to reduce hunger. But like any medication, response varies from person to person. One of the most common reasons people think Tirzepatide isn't working is simply not giving it enough time. This medication requires patience. Research suggests you may need 12 to 16 weeks or more to see meaningful results. Many people evaluate too early and get discouraged before the medication has had a chance to reach its full therapeutic effect. Dosing is another critical factor. Your clinician will start you at a low dose and adjust gradually based on your response and side effects. Never change your dose without their guidance. The medication needs to be titrated carefully to find what works best for you while managing any side effects. If you stop increasing the dose too early, you might not experience the full benefits your doctor is aiming for. Individual metabolic variability plays a huge role. We all respond differently to medications based on our genetics, hormones, and underlying health conditions. What works well for one person might work differently for you. This doesn't mean the medication has failed. It just means your body processes it uniquely. Adherence matters more than you might think. Taking your medication on a consistent schedule exactly as prescribed is essential for maintaining steady levels in your system. If gastrointestinal side effects like nausea are making it hard to stay on track, talk to your doctor. There are strategies to manage these symptoms rather than skipping doses. Certain medications can work against Tirzepatide. Corticosteroids and some antipsychotic medications, for example, can counteract its effects. Here's something important many people don't know. Tirzepatide may reduce the effectiveness of oral contraceptives during initiation or dose changes. Ask your clinician about backup methods if this applies to you. Make sure your healthcare provider knows about all medications you're taking so they can assess potential interactions. Lifestyle factors are absolutely essential. Tirzepatide is a tool, not a magic solution. Your diet quality matters. Physical activity matters. Sleep matters. Stress levels matter. If you're eating a diet high in processed foods, living a sedentary lifestyle, not getting adequate sleep, or dealing with chronic high stress, these factors can significantly reduce how well Tirzepatide works for you. Think of it this way. Tirzepatide helps reduce your appetite and improves your metabolic function, but you still need to support it with healthy behaviors. The medication makes it easier to make better choices, but those choices still need to happen. So what can you actually do about this? First, have an honest conversation with your healthcare provider. Discuss whether you've been on the medication long enough, whether your dose might need adjustment, and whether there are any medications or health conditions that could be interfering. Be transparent about your adherence and any side effects you're experiencing. Ask about your lifestyle habits. Your doctor can help you identify areas where small changes might make a big difference. They might also refer you to a dietitian or other specialists who can provide additional support. If you're experiencing certain symptoms, you should contact your doctor right away. Severe abdominal pain, persistent vomiting, or symptoms of low blood sugar like shakiness, confusion, or rapid heartbeat require immediate medical attention. If you think you're experiencing a medical emergency, call 911 or your local emergency number immediately. Also, reach out if you're experiencing intolerable side effects that are affecting your quality of life, or if you've been at your current dose for an extended period without seeing any response. Your doctor might need to adjust your treatment plan or consider alternative approaches. Here's what to remember. Tirzepatide typically requires 12 to 16 weeks or more to show meaningful results, so patience is essential. Multiple factors affect how well it works, including how your clinician adjusts your dose, your adherence, other medications including birth control, and lifestyle habits. Individual response varies significantly, so what you experience might look different from someone else. This is educational information only and not medical advice for your specific situation. Do not start, stop, or change any medication without consulting your healthcare professional. They can evaluate your individual circumstances and help optimize your approach. Have you experienced challenges with Tirzepatide or other weight management medications? Share your experience in the comments. And if you found this helpful, Hit that like button and subscribe for more evidence-based health information from Fella Health.